All right, it is 11 a.m., so we're going to go ahead and get started. Thank you everyone for joining this meeting. If we haven't had the chance to meet yet during the previous webinar or in person at the FAFCC conference, let me go ahead and introduce myself. I am Hannah. I am the sales engineer at Primavera. I'm also here with Jen. She's our operations manager, and Nick as well. He is our CEO and president at Primavera. We're excited and looking forward to today's onboarding webinar, where we'll be going over providing a training of your new patient service and database system. And we'll be answering any questions anyone has at the end of the webinar. At that time, you can chat in with any unanswered questions you may have, and we'll go ahead and get those answered for everyone. All right. So we wanted to start today's onboarding webinar just by addressing some frequently asked questions that our team has received after the last webinar and during the conference as well. First question we've received is, where can we find the recording from the informational webinar that was at the beginning of this month? It's actually on the FAFCC website under their engagement section and under the fall webinar series section. We're also planning on sending a follow-up email later today, and we'll provide that link to that recording as well. Next question, where and when will the recording of today's webinar be available? Again, with that email we'll be sending out later today, it'll be sent out. This recording will be available for those clinics that need to reference this onboarding webinar, or for the clinics that can't make today's webinar. Next, what is the difference between the last platform that was used for your forms and Primavera's CMR platform? Easily put, it's easy to use. It's a more secure platform. There's a couple of different data tools that you have the option of using as well, that I'll show everyone in just a couple of minutes. Next, does any patient PHI need to be entered into the CMR for reporting? No patient data is entered. It's the same questions, the same forms that you've been completing the last couple of years for FAFCC, so nothing has changed. Can Primavera integrate with our current EMR platform? This is a question we were asked a lot, specifically during the conference. Yes, we can, for an additional fee, integrate with your EMR. The benefit there with integrating with your EMR, it removes a lot of the manual process of completing your forms. And without an integration, the forms do have to be completed all manually. And then the last question, is Primavera an all-in-one platform or like an EMR system? No, we are not. We currently do offer a few different apps that work together in an ecosystem, or they can complement your EMR or provide tools that some clinics may not currently have. And I'll go into a little bit more detail at the end of this webinar with some more information. I'm going to go ahead and hand it over to Jen, who's been working very hard on getting all the clinics their credentials.
Hello, everyone. Welcome. So for those clinics who have signed your agreement and paid the licensing fee, you were sent credentials to the CMR this morning. For the remaining clinics that are still completing the process, we know we've been working with a lot of you, and we know there is a lot of different situations, but as soon as that is complete, our team will get that sent over to you. Once you receive your login credentials, please follow the prompts and click on the link to reset your password. So you'll log in using your username and your new password. We highly recommend bookmarking the login page for future easy access. The last step, complete your FAFCC patient services and valuation forms. I'm sure most of you are wondering, well, how do I complete my patient services and valuation forms? Well, that's exactly what Hannah's going to go over right now.
Right, yes, I'm going to go through and do the training on how to log in to the CMR, how to complete your patient services and valuation forms, and then going over the data tools that you have the option of using as well. Something to keep in mind as I'm going through this training, we are creating a user guide that we'll be sending out soon, which will provide you additional information and will help with this process. All right, so this is the login page, and you enter your email address, your updated password, just like Jen was saying. To log in, you click continue. All right. Once you're logged in, you're going to go to basically a menu page showing you the different apps we have. And then you have to drill down to the CMR, which is this right corner. And then that's the specific app you'll be using for your forms for FAFCC. You go into the app by clicking Go to App, pretty straightforward. It'll load and open up for you. I'm going to just quickly switch views for the demo account here for the webinar. All right. So I'm first going to go over the general navigation of the CMR and just explain to you what you're looking at. So first, on the left-hand side, you have your menu. You have your input forms and your two different data tools that you can use. You can choose to minimize the menu if you want to have a fuller view of the page that you're on, or you can expand it, completely up to you. You can toggle between the different apps that we have if you have access to another one by clicking on these dots here, or when you're ready to log out of the CMR, next to the name, you're going to see an arrow. You're going to click on that and click log out. Right. So first, we're going to go over the input forms, the most important part of the CMR. So this is where you'll complete your patient services and valuation forms. Again, these are just the same questions and forms that you have completed for the last several years for FAFCC. The first thing that you're going to notice is you can search for a specific form if you'd like, and that this is the reporting period for 2021 through 2022 here. Okay, then you have your 2 patient services forms and 7 valuation forms here. You can see that a form is incomplete, indicated right here, or complete, indicated by complete, and it's green as well. Now, if one of these forms does not belong to your clinic because you don't provide that service, you have an option to check it off. So let me go ahead and, so this is showing green, the dental valuation form, and you can see it belongs to our clinic and it's incomplete. If you know your clinic does not provide dental services, we do not need to fill out that form. You can check that off. It'll show red and then switch to does not belong to our clinic. If there's any confusion as to what forms you need to complete, please contact Marcy at FAFCC and she'll be able to direct you on which forms need to be completed specifically for your clinic. Okay. What's nice about our system is you can complete these forms whenever you'd like. So you can complete them on a monthly basis, or you can wait till the end of the reporting period to update all of these. If you choose to continuously update these, say on a monthly period, I'll show you what that process will look like. So for example, we have our prescriptions form. You can see that there's 1 question total. It's already been answered and completed, but you need to update that specific form. You click into it, you have your questions here, but you need to update this specific number to 1,300. There's been an adjustment. Once you've updated that number, click complete. You can see this little pop-up answers have been updated. And now that has been updated. Again, it's an option. It's completely up to your clinic how often you want to update these forms, or if you want to wait to the end of the reporting period. So that's how you would update an already complete form. Now I just want to go over how you would actually complete an incomplete form. So you can see the background questions, incomplete. 0 out of the 9 questions have been answered. So we'll just go through this one quickly to show the process. So for example, what counties have you been serving? We'll just click on those counties, click next. What county, most patients? We'll just click that. What is your structure? So we provide with mobile. Is your clinic or organization one of the following? We are a charitable clinic. And how many locations? So we'll just make that 1 location. What is the primary focus of your clinic? We'll say we provide urgent or sick care. Do patients get seen at your clinic? Mostly walk-ins, we'll say. And did your clinic or network charge fees in 2020 or 2021? We'll select these 2. And what kind of insurance did we accept? We accepted all 3, for example. That is one of the longest forms. Once you've completed all 9 of those questions, you click the complete. And you can see that it changed from incomplete to complete for you. You can choose to filter these reports by all. You can view just your completed, or you can narrow down to the incomplete forms you have left to fill out. As you're filling out these forms, your evaluation summary will automatically calculate for you. And by clicking on that, you can drill down and see the totals here. So there's nothing manual for you to do. It just pulls the data that you've entered into your input forms, and this information is sent to FAFCC. So before I move on to how you can generate a report from these completed valuation forms, I do want to mention that the data you enter into your forms will sync to the reports data tool, which I'll go into in just a second. It syncs over daily at 12 a.m. In other words, since I just updated and completed 2 forms that you saw, I won't have that updated information or that new form ready for the reporting tool until tomorrow. There is a manual process that you can update and sync the updated answer or the new form manually if you want to automatically complete forms and automatically generate a report to look at. So I'm just going to go over how you would manually do that. Keep in mind, this will be included in the user guide. So how you would sync the new updated information right away to generate a report in the data tool report. So you would click on the dots where you can see the different apps we have. You're going to click on the admin button. Once you click that, you're going to see different menu options on the left-hand side. The only one you need to click on is under Analytics, System Jobs. And you can see your forms data syncs every day at 12 a.m. But for this situation, we want to sync over the updated form and the new form I just completed. So I do that by clicking on the arrow. Are you sure that you want to execute this job? Confirm. The job has started. It takes just a couple of minutes to sync over the new data over to the reporting tool. Again, you only have to do that step if you just updated a form or completed a form and you want to automatically generate a report, and we'll include all those steps in the user guide for you. Okay. So I'm going to jump over to our reports data tool. So once you've completed your forms, you can choose to create reports to drill down and view your answers on a report view. This data tool is optional and can be utilized by those of you that may want to generate reports from your forms and view their answers visually or on a list view, for example. Just a quick reminder that your previous reporting periods and data will not be in the CMR. So if you generate reports, it'll only be on this current period. So first, I'm going to go over how to create a new report. So we're on the reports page, and how you create a report, you click New Report button. So every report is required to have a name. You can always name the report and edit it later. It's completely up to you. And then you have to choose a data source. The data source is, where is this report pulling the data from? You're only going to have one option. It's going to be questions. So once you select that, you are good to go. Now, once you select the data source questions, there's going to be a few different options that pop up to create this report. First one is columns mapping. There's no action for you here. This is just basically a key that you can reference that explains, if you select one of these columns, what type of data it is. For example, if you filter by a question, it's going to be string data, or if you filter by a end period, it's going to be a date and time data type. Again, just a key for reference here. Now the report filters, just like any other report that you've created report before, a filter is how you want to drill down to the data. What data do you want to see? So first, you can filter with numeric values. This gives you the option if you want to enter in a specific number value into this filter. And then you have specific keys. So ranging from a specific type table, a specific clinic ID, a specific question response. And again, we'll include a summary of these different filters for you in that user guide. And then you can select the condition of the filter. Is it equal to, is it greater than, or equal, or less than, or equal? And then the last option of these reports, you can choose to add a pivot graph. Pivot graph is just basically a visual graph that will show, based upon the filters you've selected in the row and dimension and field, the information for you. So I'm going to go ahead and do a couple of examples of how to create a report with this tool. So I'm going to go ahead and rename this. This will be a labs and imaging report. And I'm going to choose to filter this report by specific type name. So the type name means, what specific forms do I want to drill down to? All right. So you can see I have, let's see, I have 7 forms here. Those are the 7 forms I've already completed in the input form section. So I can select to drill down specifically to those forms. I'm going to drill down to labs and imaging. Going to click the add button right here. Okay, once you add a filter to your report, a key is going to pop up so you can reference what filters do I have added. So you can see the table type is going to be the labs and imaging, and you can always choose to remove a filter indicated by the trash can. So we're going to go ahead and save this report. You can see right here, the report was created successfully. And this is basically a list view of the report filters that I selected. So it's only showing the imaging and labs data from the input forms I've selected. So you can see everything from when those forms were created, what type of form, the start and end period, what specific questions, and the answers. So this allows me to view all of the specific labs and imaging question and answers together. Now I'm going to go back and create one more report. This is obviously a very simple report. So I also want to create a report that shows a pivot graph for you, that visual graph. So I'm going to click on new report. All right, so this name. And then the data source will always be questions. All right, and we need to select the filters. I want to select 2 specific questions that are on my input forms to analyze those responses. So I'm going to select the filter questions. I'm going to keep the condition is equal, and this lists all of the questions that are on the forms that have been answered that you can select and drill down to. Now I want to select the total value for medical visits and total for imaging services. Those 2 questions I want to see. I'm going to add the filter. Again, that key pops up for me to reference. Before I add the pivot graph, I want to show what this looks like. Okay. So same kind of layout as the other report. You scroll over. These are the 2 questions that I filtered down to, and here's the response. Now I want to go back and add a pivot graph to this. I do that by clicking on the Edit Report button. And then I'm going to check off Pivot Graph. Now I have to select a row, dimension, and field. A row is the y-axis that will show on the graph, and I want this to be a start period. So since this is a date and time specific row here, I need to select the format. So how do I want the start period to be represented? I'm going to keep it at year and month. And then the dimension, I'm going to choose what will be on the x-axis. I want to see the response to compare the 2 responses. I don't need to format this specific dimension because it's not a date and time like the start period. And then I'm going to want to see the response and the sum, or I want to see the sum. The sum shows the actual answer, and the count shows the amount of answers. Again, I know this is a lot of information to take in. On that user guide, we'll include these details for you all. Okay, so I want to save this. You can see the report was updated. Let me just scroll over to show. Okay, so this is the pivot graph. You can see this is the starting period, and these are the 2 responses. So I can see here, this is the total of imaging services compared to the medical visits, and then I have the total here. So this is just one of the many examples of how you can utilize this tool. If you want to compare the different resources that you've been using, or total values or averages of services, you can definitely do that here. That's an option. I did want to point out a few different buttons up here. So you can toggle to this view, which is the list view of that report. You can choose to just view the chart view, or what we were just on, where it includes both the chart and list view for you. That's up to you. You can choose to print this report, or you can open the filter on this page. So if you want to see what filters are added, or you want to add additional filter without going into completely editing the report, you can. You can choose to save a copy of the report, or you can add to an existing dashboard from here. Right. So I want to go over, now that we've created 2 different reports, how you're able to manage your existing reporting. So on the reports page, you can search by a report title. You're going to see the recently viewed reports, your top 2 recently viewed here. Underneath, there's going to be just a general summary of these 2 recently viewed reports, the title, when it was updated, and then you have the ability to edit or delete these. And then you have your list of reports that you've already generated. It's going to show the name, the number of filters, when it was updated, and then you can choose to edit each or delete each as well. All right, so once you've generated reports like the 2 reports I just did, you can choose to utilize the other data tool that we have, which is our dashboards. Here you can group together reports that you want to view on one dashboard for your team to maybe easily analyze related reports together. So as you can see already, the dashboard data tool has a very similar layout as the reports. And I want to just go into how to actually create a new dashboard. It's extremely simple. Click on New Dashboard. And every dashboard needs a name. So we'll name this Webinar Dashboard. And you have the ability with each dashboard to make the dashboard private, shared, or mark it as important. So we're going to make this a shared dashboard, and we're going to mark it as important. Now, how you select the dashboards, the reports for the dashboard, all of the reports are listed below that I've created, or I can also search by the report title. I'm going to select the 2 reports that we just generated. I want to view those on the one dashboard. Once I've selected them, you can see the little check icon in the upper right-hand corner. I'm going to scroll down, click Save, and then you get the little pop-up, dashboard was saved. And here we go. This is the webinar dashboard. These are the 2 separate reports that I just generated. You can see that they are public and they are marked as important. And then going back to managing your existing dashboards. So you can see the recently viewed dashboards, just like the report view. And then you have a list of all of your dashboards below. You can choose to view all of your dashboards, filter by public, private, or important, and it's up to your clinic if you want to use these options, or you can define what's called an important dashboard or not. So that was the overview of the CMR. I'm sure that answered a lot of questions. But I see that there's some questions in the chat already. We'll get to those in just a couple of minutes. But if there's any other additional questions, please chat in and we'll get those answered for you at the end. I will go ahead and hand it back over to Jen, who will be going over additional resources moving forward and just information for everyone.
Thanks, Hannah. So we do have a few additional resources we would like to share with you. For any support related questions, please contact the support email and phone number as shown above, and a member of our team will get back to you as soon as possible. We will also email this webinar later today, and you can always reach out to me with any questions. Our team is finalizing the user guide, which will be a great resource for you and your team. It will show you a step-by-step on how to access the system, complete your evaluation and patient services reporting for FAFCC, as well as generating reports and creating dashboards. When that is ready, we will be emailing it to everyone, so stay tuned. And go ahead, Hannah. Yeah. There are a lot of you who are interested in integrating your EMR system, and we are excited to host an optional webinar to review this topic together. Like all of our webinars, they will be recorded and available to you after. We will be sending out a reminder of this upcoming webinar at the beginning of that week. The next webinar date and details will be sent out in the beginning of January, so after the holidays. that's it. I'm going to hand it back over to Hannah, who will go over some other apps that we offer before we finish the webinar and move to Q&A.
Awesome. Thank you, Jen. So we just wanted to briefly go over the other apps we offer before wrapping up the webinar with the Q&A. We've had a lot of questions regarding what we actually offer. So we offer specific apps that work together in an ecosystem, and they can also be used to complement your current EMR or help improve. Some of you are still in a paper process, so we can definitely help improve the paper process you may have. So just a quick overview, our data analytics app first, it provides dashboards and reporting tools to provide you data with actionable insights. We understand that a lot of people have EMRs that their reporting isn't the best. We can definitely integrate with the EMRs to provide additional reporting that you may need. Next, we have case management, which allows you to gain valuable insight with real-time notification from hospitals here in Florida. Then you can manage and track cases accordingly for those patients. And then we have our Connect, which is our simplified telehealth app, which gives you the ability to communicate to patients through call and text message. And then last, we have the scheduler, which helps streamline and manage your practices and clinics schedule. If anyone's interested in learning more about any of these apps, these additional services, please just let us know, myself or Jen, and we'll definitely help you all and answer those questions. All right, so now that we're at the end of the webinar, we want to open up the Q&A. So if you haven't already put in any questions you may have, please go ahead and do that now. And our team will go ahead and address those. So let me go ahead and open up the chat. See what we have here. Okay. When were the login credentials sent out? So for those clinics that have assigned the agreement and paid the invoice, they were sent out this morning. If you are one of those clinics and for some reason you're not seeing it in your inbox, please let us know and we will make sure those are resent to you. What are the sources for valuations? So I'm Michelle, or this is Michael. If you could clarify that question, that would be great. And then we can go ahead and answer that for you. Can you add a legend or name the values? So whenever with the reporting tool, you select the specific filters and then you can choose the values from there. And with the user guide, we'll make sure to detail the reporting for you. Next question, we will know exactly what forms we need to complete without searching. So whenever you log into the CMR, like you saw, we have all of your forms available for you on the first screen. You complete the forms that are related to your clinic directly. You do not need to search for them. Yes, we will be sharing the recording of today's onboarding webinar to everyone. Even if you're on this call, it'll be sent to everyone to be able to reference. And yes, Amy, that was a good point. The credentials were sent from support@redwagoninc.com. So look out for that specific email address. That may cause a little bit of confusion, but that's where the credentials are coming from. So search for that specific email if you can't find it from today. Sandra has a question. Will any previous year numbers be entered into this program? As of right now, there will be no previous year's numbers entered into the program. All right, we'll give a couple more moments for any other questions. Olivia will definitely send you some different information. All right, just looking over these questions. Michael, will those values of care still be available to choose? I'm not sure with this question. Nick, do you have any insight on that?
We can get back to you on that question. I think Nick is not on here right at the moment.
Okay,
Hannah.
so thanks, Jen. So Michael, I do see for clinics that do not receive the values from their providers. I think that question may be, yes, thank you, Marcy. I appreciate that. I was gonna say maybe FAFCC would be able to provide that answer.
Perfect. Thanks, Marcy.
Awesome. So I saw that, Adrian, you're having some difficulty with loading the page. If you could just send us a quick email and we'll connect you with our support team to make sure you can log in and that page will load for you. You want to make sure you have the correct link.
Yeah, and please, I put my email in there. Please CC me. I'll help, move it and make it a priority on anything that's a credential, or, you can always add me on those emails.
Awesome. And then there was a question, how do we work on syncing our EMR with your system? Is that a separate conversation? So we are going to have that webinar in January giving additional information on that. If you want some additional information before that, if you want to have a quick conversation, if you could just drop your email and we will send over the information ahead of January. We know that it's a busy season coming up and would love to talk to you guys if you have time.
Crystal, that's a wonderful comment. Thank you very much. We're very excited to work with you guys.
All right, we're going to give it just another moment for any additional questions. Thank you, Dawn.
Love the feedback, guys.
Yes. All right. It looks like we're not getting any more questions. I'm sure there's going to be questions that pop up over time. You can contact our team if they are support direct questions. We do ask you reach out to support directly, and Jen will be sending that information over this afternoon with these support details. Yeah, and thank you all for joining. We will make sure for those of you that ask for additional information, we'll follow up with you later today. And we thank everyone again. And, I can't believe Thanksgiving is in a couple of days. And definitely our team at Primavera wants to wish everyone here a happy Thanksgiving.
Absolutely. Thank
Yes.
you so much, everyone. And again, please copy me or send me any emails if you need some assistance on directing. Appreciate everybody's time. Happy Thanksgiving.
Thank you.
Thank you, ladies. You guys did an awesome job.
Thank you
Thank
so
you.
much.
Not only did you do an awesome job, you both are beautiful. You guys should be models.
Well, thank you.
Too
The
kind.
picture can be confusing. And we appreciate it.
Listen, we're excited to work with you guys, and really the presentation was fantastic. We look forward to getting those guides and stuff that you guys are going to give us. So thank you for that in advance.
Of course. Yeah, we're excited, and I'm sure that'll help provide some additional clarification for everyone.
Absolutely. Happy Thanksgiving, ladies.
You too. Thank you.
Bye.
you.
Bye-bye.